Good morning. So, this is our new episode on how do we use that coDiagnostiX. What we are going to see now will be a case for a simple first molar. How are we going to plan for coDiagnostiX? So, we are going to start by importing. As you can see, coDiagnostic, we have a producer version, we have easy and expert mode. We always work on the expert mode. You start with the new case, import the new case. It will automatically show as quick DICOM transfer. It will also create the data set. It will take the name and other details from the CBCT itself. Okay. So it will take some time for the file to get imported, and automatically it will ask you whether to give it to the AI assistant. Please give to the AI assistant to process the data set. So as you can see, that third green button, that is the one which is for the AI. Now what we are also going to do is to give the AI assistant, tell that this is a mandibular cast, and that will also do its job to align it to the uh, lower cast. Okay, the lower cast STL and the lower CBCT will be aligned automatically by the AI. Till that time, why to simply we can also start doing our OPG or the panoramic tracing. Okay, now you can very well see that it is the first molar which is missing and upper first molar is there. So we can simply drag and drop implant in that particular site, right? So this is to show there are so many tools which can identify where we are. Okay, so that's the area of implant placement. Now this is the cross-sectional view and the tangential view, okay, together. So what we are seeing now, we are planning implant placement. So for us to know where to place the implant, we always have this idea, no, how much is the width and the length of the edentulous area. So we are measuring that with a tool. So it shows as 4.8 millimeter. So there will be another measurement which is in the form of from the top of the inferior alar canal to the crest of the ridge, which shows about 16.6 millimeter. So usually for this we can go for anywhere between 4 mm and 13 will be the implant of choice. That's how we have been trained, no? At least do a 0.5 to 1 mm on the buccal and at least 0.5 millimeter on the palatal. So 3.75 13 is what we have chosen. You can choose at the current area. Okay, you can align it. Okay, which key to use to align, right or left, all these are little confusion. You can also use this implant tool which will help us to identify our implant oriented positioning of the cross sectional and the panoramic image. So you can do the adjustment accordingly, the slices will change and it will show aligning it to the this one. By this time the AI assistant has done its job. Okay, so what all it is going to show us is the 3D objects, and you can see very well that it has numbered the teeth, bone as bone, tooth as tooth. Okay, and it has numbered all the teeth. So entire maxilla, because we don't want to work on the maxilla, so only the mandible. Okay, panoramic curve, we are going to see the nerve canals. Okay, each and every point you can see how well it is. There are times I used to sit and do all this manually. Now nothing I am doing. All these are being delegated to the AI. So now the scan alignment also will be coming here. Okay, so you can verify it multiple angle how the alignment of the scan is. Okay, so if you can critically see, the alignment is much better with the AI. Again, this one area which I am already delegating it to the AI. See, when we are positioning the implant, see, we can simply position the implant, but the thing is how it is relevant to our tooth? That's the question. We always tell about prosthetically driven implant, right? So now if you see, this is the position of that particular thing. So what we need to do is we need to position a teeth and see, right? So which is aligned now? The teeth is aligned, and now whichever is selected will show. I am going to select only the tooth. Just place it there, okay, and you can adjust it so that it fits exactly in the place, okay, like how you are doing a tooth setup, okay. Instead of doing the tooth setup in front of the burner and the flame, what we are doing is setting up here. Now this looks good, but do we need to check with the occlusion? Yes. So now we are loading the upper model, okay, upper model. Just click the copy alignment. It will automatically already arranged in your intraoral scanner. So if that is already done, if you're going to copy the alignment, it will automatically show the upper in occlusion. Okay, so now you can very well see how well is your this one. So it is slightly short, because all these things will be important to select the right abutment. Okay, when we are moving this, everything moves, okay, in all the direction. So what we have to do is just push it up. Yeah, now you are getting a good contact on the buccal side, and the fossa and the relationship is also good. Okay, yeah, you can see in various alignment. Now you can also put, so now that's the final position which we locked in. So once the tooth position is locked in, now we are going to go ahead with the implant. See, without any thing, how we have placed the implant. Now with the tooth, how the implants are positioned. Okay. Now can you see, so far lingual it is, right? So far lingual it is, but at least we want 1 mm of buccal bone, and we want it to be somewhere near to the center of that particular teeth, right? Yeah, that's it. So implant is positioned now 3.75 and 13, right? Now we are going to choose the abutment. See, as you can see, the abutment options are so many, okay? Especially in your end, the options are very much. So what we are going to exactly use is the tie base abutments, which they call it as GM exact tie base. Okay, we have different diameter, and 0.8 is the length, is uh, the gingival collar height of the abutment. Okay, that can also be chosen. Now as you can see, this looks good, but it is much below the level of the bone. Okay, so when you're placing the healing cap, or when you're removing and placing your abutment, it may not go in. Okay, as you can see here, in the cast it's far more inside. So what you can do is, you can change another 2 millimeter taller, so we can choose somewhere between 2.5 is what we are looking at. Usually we are having the diameter as a constant one, so that our ornamentarium will be little lesser. So 4.5 is the commonest one which I use both for anterior as well as for the molar. So 4.5, 2.5 is what we have chosen now. Okay, that's how this case is. Now if you see the tooth, yes, here exactly in the middle of that particular tooth, mesiodistally. Yeah, when you check with the occlusion also, it is the same. So now you are seeing the tooth. Now you are seeing the tooth, and the prosthetic tooth, the implant, and the relationship of the abutment. Okay, it's a very thin bone. That's why we are placing the implant far more inside. Okay, yeah. Now you can adjust it in such a way that at least 3 millimeter below the level of the soft tissue is what we are looking at. Okay, and at the same time we want at least a millimeter of bone on the buccal side. Since all these are implants are already incorporated with platform shifting, that will be really good. Okay, we are making little compromise on the exit point of this particular thing, so that is acceptable. That is acceptable. Okay, so that's the implant. That's the model. Now we have so much of space for the prosthetics or the crown material, right? Now we are going to choose. There are two guides that are available with Neodent regular kit and Neodent easy guide, but we are going to choose the regular kit, and it will automatically show you a blue thing. There are two options, 9 and 11 millimeter. That means from the top of the sleeve to the base of the implant, it's about 9 millimeter or 11 millimeter. Okay, we are also going to project the root of this premolar and molar for us to know. Sometimes know when it is tighter space, it may be closer. It will look good on the cast, but when you see the X-ray, it will be closer to the this one. Now what we are seeing, since all the things are compromised, understood, now we are going ahead with the fabrication of the guide. We are telling the model generation, which is the path of insertion. It is blocking all the other undercuts. Now we are just going to choose where all you want contacts. Okay, just takes few minutes. Just take the contact. We also have a offset. That's it. 0.2 millimeter is the offset when you have a tooth supported guide. Okay, where we are creating some of the areas for inspection, whether it is seated fully or not. That is what we are creating now. We can increase or decrease the dimension of this cone so that it will be easier. You can understand how well we are able to prepare, or whether it is seated well or not seated well. Okay. So inspection windows are created. We are going to add some of the presets, select the name or even the position of the guide, tooth position and the date. So many things you can add. So patient name along with however it is entered in the CBCT, that's how it will be shown. That will also get printed. Okay, that's all. It takes few minutes and the guide is actually ready, right? Guide is actually ready. So you can export it, and if you it will be telling you that if you export, the guide fee will come down. Okay, and it will be exported into the file that can be sent for printing. All right, see, suppose, and you can also take a printout of this particular thing. Okay, whatever is shown in the screen will be printed as the first page. So you can keep upper, lower, okay, and also come down, add the mandible. So now this will really look, it will give in a nutshell what is the information that all we require. Now if you take the printout of this particular thing, it will be the first page. Yeah, print all. Okay, what all detail, screenshot, everything. So this screenshot will be the one that will be shown, and that can be saved as a PDF. See what is the materials that are required. That's the cross-sectionals and the panoramics. That's the surgical protocol for this particular case. That can be printed and that can be saved as a file. Okay. So two outputs you have taken. One is for the surgical guide, another one is for the third one. What we are going to do is exporting the prosthetic information to the lab. See, lower arch we are selecting, and then we can add the intraoral scan body into the lower cast, so that even if you want to make anything like a temporary crown, a customized gingival former, all these can be done in the exocad. That can also be saved. This file will be saved as it is. Okay, along with it looks like as if we have taken an impression. And if I'm going to send only the lower, will it be all right for him? No. So I have to send the same way the upper cast also. Now what we are doing is we are just changing the implant from this to another one. That can also be done. Say suppose the same case I wanted to do a Straumann, just change the implant in BLX or even TLX. Okay. You already know it is about 3.75, right? 3.75 instead of 8, I will be changing it into 12 or 14. Okay. So now 12, and we are going to change the abutment. See, so many abutments are available. So here also what we are going to use is tie base abutment. Okay. Yes, that's the they call it as vario base for crown, and 4.5, 2.5 because we already know that the same thing only we have used for neodent as well. Okay. So nothing much is changed. We will have a very beautiful outcome with more than a millimeter of bone. Here also we have two guide, Straumann eye guide, which is not yet come to the market. We have the regular Straumann BLX guided kit. They have three options as far as the positioning of the sleeve is concerned: 2 millimeter, 4 millimeter, and 6 millimeter. It is from the uh, top of the implant to the lower surface of the pin. Okay. Now, if you see, this will be into the soft tissue, or sometimes it may be into the bone also. So we are just changing it into 4 millimeter, and we are confirming it in other views also. So 4 millimeter will be good. Now, if you go and see the surgical protocol, it will show you what is the spoon that needs to be used, what is the guide, the length of the guide that needs to be used. Okay. Or the drill that needs to be used. So once this position is confirmed, right, implant abutment, and if you see 6 millimeter, it will be too far high above. If you see the surgical protocol, it will show that there will be different, right, single dot and 3-step, the third drill, the longest drill that it is going to show. Okay, so we are going to show with 2, then the surgical protocol will be changing, right. All these permutation and combinations are inbuilt in the software, so we don't have to sit and break our head, right. So that's the 2 mm height, generally looking good, but it will be below the level of the bone in the mesial side and below the level of the soft tissue in the distal side. So 4 millimeter will be ideal. Then with the 4 millimeter, we are going to go ahead with the guide fabrication, right. Same way, you choose the path of insertion of the cast. It will block out all the other undercut areas in that position, and you are going to choose the areas that needs to have contact with the cast. So 3, 5, 3, 3, 3, 2, and then automatically all these points will be connected by the software. So you don't have to sit and do anything. You can increase or decrease, and we always believe in having a one more cross-sectional area, right. So offset is usually 0.2 millimeter for the tooth supported guide, right. And you are going to add the inspection window like what we saw in the previous one. See, at least couple of areas in the anterior region. Definitely one has to be on the posterior distal to the implant placement, so that you will be very sure whether it is seated well or not. On to the last molar, right. Done. So we are going to add the preset in the form of the patient's name, Okay, you can even add the surgical details also. So now, see, for the same case, even if you want to export multiple guides, it's possible. So just that already we have a Shrija mandible that is for the neodent. Now you just tell that this is for the Straumann BLX guide. So just save it as it is. That's it. Close. Done. Yeah. Just warning you, you have already one guide which is different, and one you are having another guide which is different. So that's what it is saying. Done. Same way. Show the mandible, show the teeth, and that's how we are going to and you can add the tooth and upper cast. Now you can take the printout. Alright, the printout is ready, which will be sent to my front office so that they can make sure that all the materials are there before the surgery. And this can even be sent to the patient. That will be a good educational tool for them also to understand what we are doing on the background. All right. So what we are doing next is the prosthetic export, lower arch, next scan body. So that's the scan body, BLX. Then export the plan as it is. Close. I think it is done. Overall, we just saw how to deal with a simple case for start to finish for a molar, for a simple case of first molar replacement with neodent and Straumann implants. Hope you enjoyed the session. Thank you. See you once again with a new video.